Thank you, Mr. Chairman. And Madam Secretary, welcome to our hearing. Madam Secretary, I appreciate you bringing up the Older Americans Act. We're looking at, the committee's looking at ways to promote best practices to combat elder abuse. And I wonder if you could talk a little bit about how the department is working with other agencies to protect vulnerable elders.
So working across the department, and obviously the Department of Justice is a partner with some of the work we do, but most recently, whether it's with our departments and states as well as other stakeholders, the White House Conference on Aging, we took an approach this year where we actually went out to communities across the country, and this was one of the pillars and issues that we focused on, and used that as an opportunity to bring in the engagement and involvement of both ideas, as well as how we can implement better as a department in terms of the issue of elder abuse. So we're seeking that input to improve what we're doing both within the U.S. government, but also with a number of the players that implement, and those are stakeholders on the ground in states, because many of the programs are actually delivered and implemented at that level.
And would you discuss a little bit those delivery models of the Older Americans Act and what makes them work well? I'm working with other agencies, I'm sure, is the right thing to be doing, but are there ways to implement these similar delivery models across other programs across the country, and how is the department providing leadership to do that?
So I think there are many things, but I'll just focus in a short time on two things that I think are important in this space. And one is actually the awareness of the issue. Elder abuse is something that is not an issue that many focus on, and whether these providers and the organizations in the community are a part of recognizing the issue. It is a little like our issue that is also the victims and trafficking. Creating a greater awareness of it is an important thing to do. I think the other thing that we think is an important thing to do is that when these acts occur, that justice is served. And so that people know that when they are taking advantage of the elderly, and that's a place where we need to continue to work with state and local officials on that, as well as federal. And I think one very specific example of that is the recent takedown that was done on Medicare. You all probably know that our most recent takedown, which was a joint effort with us, DOJ, the FBI, HHS, OIG, and CMS, it was over $700 million in false billing. And many of those examples were around elder justice issues where patients were being told they were being treated for dementia and were simply being moved from one location to another, being charged for that, and Medicare was therefore charged. So I think it is the combination of those kinds of things that we try and bring together.
Thank you very much for that. We know that you are, Congressman Scott brought up Head Start performance standards. Mm-hmm. We know that Head Start is the largest program we have at working with young children, but we're concerned about the impact of the new regulations that you're putting out there. We wanted you to not, our reauthorization 2007 required you to have regulatory revisions not result in the elimination of or reduction in quality and scope of services, but you are talking about a reduction of 126,000 children's slots, elimination of 10,000 teachers' jobs. How can you ensure that the revisions that you're proposing are in compliance with the 2007 law?
We have done 3 issuances of regulations with regard to implement the law, and this is the third of those. The first in terms of, one of the things we did was make sure they're serving low-income communities. The other was making sure that there were reviews and people had to reapply for the money, the grantees, and so we set standards there. This is the third part. And in this part, we are using evidence-based studies to improve the quality and safety, which we believe that the authorization is what it told us to do. One of the things that the chairman mentioned that I think is important to mention is we got rid of 1/3 of the guidelines in terms of simplifying and making it easier. With regard to some of the things you're referring to, I think you're referring to the extension of the day and the year. And the evidence that we have seen, all the scientific evidence shows that moving from 3.5 hours to 6 hours is an important effort to provide the quality that we need to provide. And the summers, having 2 children right now going through their summer, what they lose if they do not have that kind of continued education. We propose the amount of money that it would take in our budget. We're hopeful that we can move forward on that. And the other thing is, if grantees can't meet that and have reason not to, there is waiver ability.
Thank you.
Gentlelady's time has expired.